Good afternoon. Welcome to the California Health Interview Survey CHIS Data User Training webinar. We'll be spotlighting our new CHIS data release and our demonstration of AskCHIS query systems and Neighborhood Edition. My name is Peggy Toy, and I'll be providing the overview of a CHIS, and I'll be doing the AskCHIS demo. Joining me is Jacob Rosales, the CHIS Data Dissemination Manager, who will go over AskCHIS Neighborhood Edition, as well as a review of the COVID-19 dashboards that have been recently updated. Moderating today's webinar is Tiffany Lopes, who is our Communications Director. And we encourage you, as we move along, we will go through our presentations and then open up for Q&A. But please write your questions in the chat box, and some of those may be answered as we move along. But it's also a placeholder for questions you have from the presentations, and can be responded live during our Q&A. I also want to say that we really appreciate your attending today, and we'd love to hear your response to the training and the presentations. And so please take time before you leave the webinar to complete the evaluation survey. The link to the survey will be placed in the chat box. So again, thank you. So I'm going to give an overview of the California Health Interview Survey very briefly. It's the nation's largest state health survey, the most comprehensive source of health information on Californians with a wide range of health topics. And you can see some of those topics on the screen, from health status, conditions, health behaviors, oral health, access to care, health insurance, and respondent characteristics, that is the population that take the survey and the characteristics of that population. Nearly 20,000 people or more participate in the survey each year. CHIS is a collaborative project funded by federal and state health agencies, California national foundations, and others. So the CHIS survey is an interview, and those that are included in the survey, who take the survey rather, are adults age 18 and older in the household, adolescents ages 12 to 17 if they're present, and children ages 0 to 11. Adolescents participate with the parent's permission. And then children are interviewed by parent proxy, that is, the parent responds for the child. CHIS is conducted in multiple languages: English, Spanish, Chinese, both Cantonese and Mandarin, Korean, Vietnamese, and Tagalog. CHIS has really evolved over the years to expand its methods to reflect California's diversity. So they do this by targeting sampling methods, to ensure that that we have a representative pool reflective of the population that participate in the survey. Multiple methods of collecting the data. So it's done by web, by letter, and other ways that they reach out to collect the data. There's language support, so to ensure that there's clear communications with the respondent. Custom oversamples, that is, they will target in on a population to ensure that that population is included in the survey. And then there are follow-on studies to extend the participation in a number of topics that are explored from the survey. So with this methodology, CHIS has been able to collect data and report it in almost near time. So some of the data that's been added from 2021 to 2022, it encompasses some of the most relevant topics of interest today. And you can see this robust list of topics that have been added to CHIS, from climate change, firearms, firearm victimization, cannabis use, housing security, encounters with police and the court system, adverse childhood experiences, paid family leave, and so on, and COVID risk reduction practices. And these are, and also we've reinstated some topics that had been present in previous years have been re-added to the survey. So we're going to take a look at AskCHIS and look at some of these topics in our demonstration, but we wanted to show you that the wide range of current topics of interest that are available from CHIS. So here's some noteworthy additions to adolescents and children. So some of the new topics that have been added is the impact of climate change on mental health, encounters with the police or court system, and adverse childhood experiences. Some topics have been reinstated, which is sugar sweetened beverages, presence and storage of firearms, and concerns about being victimized by firearms, and school days missed due to health problems such as dental problems and other topics relevant to adolescents and children. So with this, I'm going to go to the AskCHIS website. But first, we're going to do a quick tour. We're going to do a quick tour of our website. Because we want, beyond AskCHIS and AskCHIS Neighborhood Edition, there are a number of resources that are available. So you can get to the California Health Interview Survey by Googling. It will take you right there. But wanted to show you the landing page at the center, where you have a number of publications and reports that have been done using CHIS data. And on every web page of the center's website, you'll see this banner at the very top. And everyone has the California Health Interview Survey and all of the content that's available on that site. And then you can go directly to AskCHIS. And then the health profiles, this section is being currently updated. The most recent update has been to the COVID-19 dashboards. And these are preliminary monthly estimates, and Jacob will go over that with you. So I'm going to go into the California Health Interview Survey landing page. And I think this is really helpful to see all of the research that are available to understand the CHIS data and the scope of topics that are asked, some of the background about the survey design and methods. You can actually see the survey for each year that it was asked and the methods that were applied. You can get the CHIS data in other ways. If you want to access the data directly, this may be for some of the more advanced users, but CHIS is designed for multiple users. And so AskCHIS is set up in that way. And we'll talk more about that in a second. But this is, you can obtain public use data as well as confidential data. This is the raw data, and apply this with your own statistical software to do your own analysis. And if you go into this page, it will tell you how to apply. And then finally, in looking at all of the resources here, I do want to point out that we have an on-demand learning center, which includes videos, video tutorials that will go over some of the features of AskCHIS and AskCHIS Neighborhood Edition, so that as we go through some of the features that we're going to demonstrate today, if you want to have a review, you can go back into our on-demand learning center to review the videos. So with that, I'm going to go right into AskCHIS. So this is the AskCHIS landing page, and as you can see, both AskCHIS and AskCHIS Neighborhood Edition is shown here. This is your portal to both systems. AskCHIS is a user interface to find health statistics using a very sophisticated statistical system behind your query. So we're going to take a look at the variables you want, or the topics you want to look at, and other factors such as population characteristics or other topics to compare with your main topic. And you enter those and it will produce an estimate. AskCHIS Neighborhood Edition is a geographic a GIS system where the estimates are modeled, which is that the team produces common indicators and will produce that in a geographic format. And so the difference between the two is that you can see Neighborhood Edition is available in Spanish, whereas AskCHIS is only in English. And because of the wide range of copy, you're actually accessing the statistical data on AskCHIS. And on Neighborhood Edition, you're seeing those estimates displayed in geographic form. And it's very exciting. And Jacob will go over that with you after the AskCHIS presentation. This is our AskCHIS landing page. And as you can see, I've already set up my account, but I really encourage you to create your own account. It enables you to any of your work can be saved into a library. You can go back in to access that. And it enables the CHIS team to actually look at our users and to ensure that we are touching on topics of interest to users of the data. So I'm going to log in. So this is the landing page for AskCHIS. And as you can see, you have the banner of fields right at the top that you enter information that will inform the process to produce an estimate based on your inputs. It defaults in the geographic area, our first field, to the state. But as you can see on this page, excuse me, you can see a listing of all 58 counties in California that are organized by region. And so we can see here we have Northern and Sierra counties, Bay Area, Sacramento, and so on. For Los Angeles and San Diego, you can access more localized health areas. So I think what's exciting this year is all the new topics that have been added to CHIS. And I want to show you some of those that are available in AskCHIS. And as you can see, we have categories on the left column. And you can see all of the major categories from health status, health conditions, and so on. These are some of the topics that have been available over a period of time and are frequently asked in the survey, demographic, and so on. So some of the newer topics have been added here: childhood experience, climate change, encounters with law enforcement, guns and firearms. I like to explore the categories because every data source has only a scope of topics that's available, but it does enable you to explore what's there to determine if there's a match to your interests. But you can also certainly search for a topic. One topic I want to take a look at, this is just one topic to demonstrate a very simple estimate. So CHIS is great to grab a quick estimate, but you might take a look at some of the other factors you want to include in your query for a more detailed analysis on a particular topic. So here's our list of topics available under gun violence. And as you can see, this topic was asked in 2021 of adults. But as we go down, we can see a number of subtopics: handling a gun without adult supervision, victim of crime, worry about being shot by a firearm. So when we select a topic, and you can just explore this on your own, you really want to do this presentation to enable you to experience or explore AskCHIS on your own. One of the things I'm interested in, and one topic of interest currently is, hold on a second. I'm going to go there. Ever worry about being shot by a firearm? So let's take a look at that topic. So when you click on the topic, it will show you the years it was asked. This one was only 2021. It was asked of teens, and the results are displayed in the following levels of yes or no. And then you will see a description of how this variable was constructed. And it tells us that respondents were asked about gun violence, gun ownership, firearms, and gun safety. And this was asked of all teens and concern about those topics. And that was condensed into this variable, ever worry about being shot by a firearm. So we're going to do a search here. I'm sorry. So once I selected the topic, it does show in our banner, our topic field. And so again, it defaults to the state, but we're just going to take a look at. So we can see that this is the estimate for California. So our estimate at 38.4% answering yes. When we hover over that, it tells us what this estimate means is that 38.4% of the population, which are teens, answered yes under this topic. The figures in parentheses is the confidence interval. And this is a range from 35.2 to 41.5%. It's a narrow range. And that means that there is the confidence interval means that that value, that estimate reflects the true value for the population. One of the things about AskCHIS, you can see every feature on here has an explanation to describe not only that topic or that feature, but also explaining the data. So you'll see here in the lower left-hand corner, description of the confidence interval. And it says the number range in parentheses, as I just said, that it is very close to the actual values of the entire population of California. This estimate is based on formulated weights and analysis using a large-scale sample of the overall population. So when you see a very narrow confidence interval, that means that you could rest assured to use that estimate. We're going to take a look at some data where we don't have a stable estimate, and you'll see that the confidence interval is low because there's a wide range for the confidence interval. And then you can see that the estimate, this is the estimated population that would answer yes to that question. So this is a simple estimate you can produce just entering your topic. But maybe you want to do a more detailed analysis. So one of the things about working with AskCHIS, you can save previous tables. So with this, I'm going to select another topic, and I'm going to, as you saw, I had a table I want to use. So I'm going to clear the query. Let's go back to our topic area. Let me do that. Okay. Select the topic. So I'm going to look under mental health. Here we go. Mental health and emotional health. So you can see a number of subtopics under mental and emotional health. I'm going to select emotional health. The other topics, access and utilization and suicide. This has the widest range of topics or condition that might affect anyone during this period of time. So the different subtopics are likely has had a serious psychological distress during the past year, a social life impairment, days unable to work impairment, family life, and so on. There's a number of topics under mental health. Mental health is one of the topics that have been asked for a number of years. So when we select likely has had a serious psychological distress during the past year, we can see the number of years it was asked. It was first asked in 2015 through the current year, 2021, currently available year. age group, teen and adults. And the results are displayed on the following levels: likely has had psychological distress or not likely to have it. And then it explains this variable. It's really key to look at how the variable was constructed. So this variable was constructed asking or measuring rather psychological distress in the past year using Kessler-6 series, which is a standard series for measuring psychological distress. The distress in the past year was assigned to those who indicated a month worse than the current month that they were responding to the survey. If the respondent did not indicate a worse month, the current month's distress levels are assigned. So we're going to select our topic, and let's see if we can get rid of that warning. If we did. So again, we're in California, right? And so we have our result here. Now this combines both teens and adults. And so of that population statewide, 18.6% likely had a serious psychological distress in the past year. It's a stable estimate statewide. So if we take a look at the topic, it only gives us a singular picture, and that is overall combining both teens and adults. But I want to take a more closer look at this, at teens and adults and how they responded. So I had already done a table beforehand. I'm going to select this table. So here we have a warning that our table has produced unstable estimates. And so it provides us with a solution. And the unstable estimates is indicated by an asterisk. And CHIS recommends against reporting or relying on these estimates to be a true value of the population, answering yes to the question. But it does give us some solutions. One is pooling the years. That is bringing the years, a number of years together, because an unstable estimate is produced because the sample size is too small to produce a stable estimate that's a true value for the population. So if you have a topic that was asked in multiple years, you may be able to pool the years. If you have a compare by topic, you can go collapse the topics, but we'll take a look at those solutions later, but let's see what our results are. So as you can see, we have it broken down by all of our populations groups, and it shows individual years in which this question was asked. And some of the years, like you can see here in 2015, we have an asterisk. So there's a lot of asterisks in this table. So what we want to do is let's take a look if we can pool the question. It doesn't allow us to pool the years. So let's take a look at one of the things that we have is our regions in California. So when you're unable to pool the years, you want to take a look at the geographic area. So we're going to go back to the state of California, our default geographic area. And let's take a look at, okay, let me start back over. Let me go back to my topic. Okay. Let's see. All right, let's start over again. Let's select the topic again. Emotional well-being. All right, there. We've restored the years, so we'll get our data. So we have, again, that's our population rather, which is teens and adult. Let's see if we can compare by age. So let's try a different topic. Let's try another demographic. I think this may be closer. So we want to take a look at all of our demographics here. We can do age and gender, and we just displayed that. Let's take a look at race and ethnicity. So as we can see here, we have a number of sources for race and ethnicity. The Office of Management and Budget, Department of Finance is the most common. And it shows us this was a source of data we used from the very beginning, 2001. And you can see the age groups that are included, and then the race ethnic categories. And you can see races are displayed as non-Latino racial categories, and then we have a Latino category. There's the census. The census has a number of racial categories also available since 2001, but there's no Latino category. It just talks a bit more of how the census categorizes race. And then the center itself, beginning in 2007, developed their own categories for race, which is how the respondent identified with race, that respondent identified with. And so with that, I'm going to go back to OMB. It's the most commonly used source of race ethnic data. So we have our compare topics, state of California, our years, and that's our results. So we have, again, the unstable estimate warning. And as we can see, we have some population that, again, sample size, even for the full state of California, is produces an unstable estimate for Native Hawaiian Pacific Islanders. Now we can pool, but I want to see if we can select some years. So here we have now multiple years. So because the estimate was 2021, let's try pooling and see if that solves for us. 2021, 2020. So we'll do the last 5 years to 2017. And this, we don't want to compare, but we do want to pool those years to see if we can increase the sample size for Native Hawaiian, Alaska Native. Okay. So as we can see, we stabilized for the state of California. So that solution worked for us. Well, let's say I'm interested again. I'm going to go back to a smaller geographic area. I'm going to select other Southern California counties. I think this is a good mix of both coastal and rural counties in California. And we're going to select those. That's Orange, San Bernardino, Imperial, San Diego, and Riverside. Now, we didn't limit the population because we're already limiting by race ethnicity. So again, our unstable estimates, let's see what we have here. So we have stabilized for Native Hawaiian Pacific Islanders, but for San Diego, we have a smaller sample size for American Indian, Alaska Native. And so we have that unstable estimate. We could include it in a, let's see what lapse compare by. So it shows us all of the racial ethnic categories that we have. So let's include American Indian, Alaska Native with 2 or more races. And let's see what that produces for. So we've stabilized all of the populations, but you can also select, if you're interested in American Indian, Alaska Native, you can, under your topic, compare topic, you can look at the demographics, and you can select American Indian, Alaska Native to take a look just at that population. So here we've stabilized all of our estimates, and we've pooled our years. And one of the things that in reading this, it shows the percentage of those who are likely had a psychological distress within that population. 14.9% among Latinos, and pretty much fairly close, a very high percentage with Native Hawaiian Pacific Islander. But one of the things we can do to take another look and change our denominator. Now, we still have some unstable estimates here. This is our Native Hawaiian Pacific Islander. So when we look at the topic from this perspective, that is, within all of the populations that answered, they've likely to have had a serious psychological distress. We can see that the Latino population is a larger share of those responding that they had a serious psychological. So this is one of the tools you can use to change the analysis to provide a more robust look at the topic. And if you're serving a population with this mix of populations within your area, this may indicate where you need to look to address some gaps in services or to address a population that has a higher than a disproportionate number percentage of psychological. So this is some of the tools. You can also, we compared the topics, we collapsed those. We transpose the topic to change your analysis. You can also compare to California. So one last thing I want to demonstrate for you is some of the charts and that we have available to display the data. So a bar chart, you can see at a glance where the population is. So we have American Native, Alaska Native. So this is likely has had a psychological distress. So this is the white population, 39%. This blue line is our Latino population. That's the chart that we see of those who answered yes to that question. Those are the two highest, those two populations have the highest percentage of those responding yes. So let's take a look at trending. On the chart, you can also do a pie chart. So now we don't see the trending because we're still in pooling. So we have to produce a compare by. So we want to look at the different years in order to get a trend. Here. So it went back to comparing the years. That's why we still have those unstable estimates, but we did this for the purpose of showing a trend. Likely has had psychological distress. That's the trend line. And we can see over the 5-year period, changes or differences in the years for different populations. So there's our Latino Hispanic population right there at the top, variation over the years. One thing I find interesting about this trend chart is we see this red line is our Asian population. And what we have here is over time, even though there's been some variation, really shot up during the COVID years. And that was the year that perhaps the racial discrimination and hate crime directed at Asian population may be one of the reasons for the uptick in psychological distress in the past year. So this is just a start. Where else to look? What explains the trend and the increase in psychological distress or the changes over time for some of these populations? So this is the CHIS, along with other data, can help to shed light or answer that question. So with that, one last thing, we can save it to our library. We can also export it into an Excel spreadsheet to do multiple analysis, looking at age and other factors in one spreadsheet to do further analysis. So with that, I'm going to stop sharing my screen and I'm going to turn it over to my colleague, Jacob Rosales.
Thanks, Peggy. Hello, everyone. My name is Jacob Rosales. I'm the Data Dissemination Manager for the CHIS. Let me get my screen rolled up here. Okay. So I believe you all can see my screen. It's on another monitor, so I'll be shifting over. So here's the landing page for AskCHIS Neighborhood Edition. When you put together a login for AskCHIS, it's going to be the exact same login as AskCHIS Neighborhood Edition. So it's just, most people, I'm one of those people where I just have my browser save my login name and my password because we're juggling a plethora of passwords and usernames and stuff. But it's pretty simple. Whatever you use to log into AskCHIS, it's the exact same thing you're going to use to log into AskCHIS Neighborhood Edition. So I just want to, one thing I want to point out is real quick is the differences between what you saw in the AskCHIS platform that Debbie was what Peggy was demoing, and AskCHIS Neighborhood Edition. AskCHIS, those are direct estimates from the direct weighted estimates from the survey. AskCHIS Neighborhood Edition are modeled small area estimates. There's a kind of like the magic of statistics. We're incorporating data from the American Community Survey as well as Claritas data to develop these modeled small area estimates so that we can give you estimates at census tract, at city, at zip code, legislative districts, those being state assembly district, state senate district, congressional district, as well as county and state estimates. So these are modeled estimates in here. So another thing you'll notice is the health indicators, the topics that we have from the CHIS, they're much more robust in AskCHIS versus AskCHIS Neighborhood Edition. We kind of had to limit those because of all the computational time it takes to develop those those modeled estimates. So before we get into talking about selecting a topic and the data that's in AskCHIS Neighborhood Edition, I just want to point you out to this section here, the help area. This provides them just kind of, you get a brief kind of breakdown on how you would go about running your queries, general information, information on the indicators, data limitations and use, methodology brief, GIS information, and FAQs. So I highly recommend going through this, and if you ever get stumped or anything, a lot of your answers can be found in this whole help section for AskCHIS Neighborhood Edition. But of course, if there's questions that you may have that aren't sufficiently answered through this portion, you're more than welcome to email us at chis@ucla.edu for other follow-up questions that may not be answered here. But I wanted to point this out. This is a good section for you all to check out. Okay, so we're gonna go and select a topic. So we have this broken down on the landing page. The default is it kind of shows the health topics. So the health topics here, these are all derived from the CHIS. These are all CHIS small area modeled estimates, with the exception of the food insecurity. This is not the food insecurity, the life expectancy. This is from 2016. This is a small area estimate that was developed by the CDC that we just added this year. And that's only at the census tract level. All the other health topics, though, those are at all the geographic levels. We have environmental factors from the Cal Enviro screen. We have the latest and greatest one for 2020 in there. We also have sociodemographics from the American Community Survey, 2018, 2019. So you see, it's in 2-year increments, except for we used 2019 because 2020 with the data collection, it was a little wonky. So we decided to go with 2019 instead. And then we have these vulnerability indices, area deprivation, healthy places index, pre-existing health vulnerability index. This was created by the UCLA Center for Neighborhood Progress using some 2016 small area estimates from AskCHIS Neighborhood Edition, and then also the social vulnerability indices. Okay, let's go to the health topics. We're going to kind of piggyback off of what Peggy was going through and talking about mental health and serious psychological distress. So I'll go down here. I'll select our latest and greatest. Please note that we're always we do data updates to AskCHIS Neighborhood Edition every 2 years. So we won't have any 2021 data added. Our next update with the data will be in 2022. I did notice that someone had asked a question with regards to some of the newer topics that were included in 2021, if we'd be including those. for updates for AskCHIS Neighborhood Edition with census tracts and whatnot. We're exploring that right now. Part of it is with creating these modeled small area estimates. There's a lot of kind of calibration and looking at sample size is an issue and whatnot. So it's we're exploring which editions we want for the 2022 updates, which will probably, I'm guessing, will be after next year's data, the 2022 data release, which will be sometime in early fall, probably end of September, early October is usually when we kind of shoot for that data release. So that'll probably be sometime in 2024, probably around, I'm expecting some early 2024, springtime 2024, before we had the 2022 data in there. There's a little bit of a gap, but we are exploring additions. So I just want to let you know that. But now let's look at mental health for 2020. We're going to go with the serious psychological distress. And we get the estimate for California. This is constructed, it gives you an example constructed using Kessler 6 series, adults 18 and older who reported serious psychological distress. In the data table here, you get the estimate for the state of California. Now I want to add some geographies here. So I will go into my location. I'll click on location, and I'm going to look at Los Angeles. I'm just going to do a quick search for Los Angeles, type that in there. I'm going to select Los Angeles County and the city of Los Angeles first. So now let's create the table. So I get the estimates added for city of Los Angeles County, and California. You see, I get a bar graph here that kind of shows a comparison. It has a kind of like a trend line that shows kind of like where the state estimate is. So like the different geographies, you can see how they compare to the state. The map by default is going to show the city. It shows a map of a chlorophyll map of all the different cities. So if you wanted to widen out and look at the entire state, you get that. You can go in here in the key and select different things. So if you wanted to explore census tracts right away, you could just select census tracts and we do that, or zip codes, the assembly districts, senate districts, congressional districts, etc. You also notice, I'm going to just go to our counties real quick, just so it's a more fuller map. You'll notice we have this widget here for demographics. So it's going to show you information on federal poverty level in that area, race and ethnicity, and population broken down by age and gender. So as I hover over the different geographies, you're going to notice that the widgets are going to be changing with the demographics. We also have this histogram down here showing kind of like the breakdown by the different counties. So if you hover over here, I look at 12%, this bar for 12%, it says there's 6 counties within there. I can also kind of filter out the map. So if I want to just see counties that are essentially at the Los Angeles level, then I kind of like it'll shadow out those counties that are below that level. So you can do it either at the low end or at the high end. So maybe you just want to focus on those counties that are below LA County, then you can do it like that. So it's just some features that you can do to kind of like explore. So it's just a quick kind of thing. And then you notice as you hover over, you get information on the estimate, the 95% confidence interval and the estimated population. Also, you might notice that on some of these, so this is, I think it's Alpine County. Most of Alpine County, it tends to get suppressed. We're suppressing for areas with a low population, or if there's, it's either going to say suppress for low population or instability. So if it's an unstable estimate, it's also going to have these kind of like hashes through it. So you'll notice that more when you're working through the census tracts. So let's go. We're going to add some more geographies. For the search, right here on this regular search location, this is anything from, type in the name of a city, type in a county name, or if you want to type in a zip code. So I'll just do this one because I have it off the top of my head because let's see here. So I will do, I'm a child of the 90s and I remember that TV show. It warped my mind. You can type in zip code. So whatever zip code you have, you could type that in there and then add that, and when you do the create table, it'll add that for your zip code. Now I'm going to go to select census tracts. Now keep in mind for the select census tracts feature, it's only going to work for data from 2016 and beyond. We have 2012 and 2014 estimates, but we weren't doing census tract data. So if you just look at 2012 or 2014 data and don't indicators and don't have any indicators selected for 2016 and beyond, the select census tract feature is not going to work for you. But because this indicator that I'm looking at is for 2020, I get it to work. What happens is you get this GIS map that pops up, and you can kind of go around and hover around. You can zoom in and zoom out. So if you want to, you can kind of get a deeper street view. We have like over 8,000 census tracts in the state of California, so it's a little bit it's a little different from searching than for your counties and your cities and your zip codes. We have this feature where you can actually type in an address and search it by get a census. So if you wanted, like, say maybe this is where you live, I just checked out this census tract for Playa del Rey. I was looking at this and I was like, I want to see what serious psychological distress is for a beach community in Los Angeles County versus someplace in more like South LA. So this is the address that I have here in Playa del Rey. You see it points it out. And now if I just select it, it's going to tell me the Los Angeles County tract 2781.02. I'm going to add this down here, and then it gets added. Now I'm also I want to look at this other census tract for South LA. I put in the address, do the search, highlights it, and I'm going to add that selected tract. And now it tells me I've reached the maximum of 5 geographic entities to compare. We only allow for 5 comparisons of counties, or geography, sorry. So now I'm going to create my table. Now you're going to see it's loading, and it loads on this tract in South LA. And you see here, we get to, now you can kind of see, wow, you got like South LA, 25.2% serious psychological stress amongst adults 18 and older, versus if we go to the Playa del Rey one, we have 8.4%. This kind of allows you to kind of look at geography and neighborhoods and kind of get a sense of where you're seeing high prevalence versus where you're seeing low prevalence. For me, it kind of makes sense. This is a beach area, no bad days. So maybe and there's probably other issues with regards to socioeconomics, race, ethnicity, and whatnot. And you can actually, if you wanted to, we could go into your sociodemographics and you can add some other information. So if you want to look at living in poverty. And so you definitely see here, yeah, there's, wow, you're getting high prevalence of serious psychological distress and poverty in this tract here in South LA versus the beach tract, low level of serious psychological distress, and also low level of those that are in poverty. Keep in mind that we're defining poverty here as less than 100% federal poverty level. I know that there's a lot of different ways to look at that, but for the purposes of AskCHIS Neighborhood Edition, we're just talking poverty with regards to those that are below the 100% threshold at the federal poverty level. We can also look at race, ethnicity. So I want to look at Black only. You can see the percentages for that. We can also look at, let's look at Hispanic, Latino. So there's a myriad of different things that we can throw in here. When we create our data table, you can make this as big as you want. So if you wanted to put everything in there, by all means, you can put everything in there. I'm just going to remove some of these because I don't want this to be too overwhelming on the screen. Now you notice that we were just looking at the single census tracts. One thing that we're allowing with the census tract lookup is, and I'm just going to remove the city of Los Angeles. I'll keep Los Angeles County there. Is we allow users, you can group your tracts together. So you can actually create your own custom neighborhood if you want. And this works really well in places like Los Angeles, in the city of Los Angeles, also like San Diego, San Francisco, Sacramento proper. And those more densely populated areas, you'll notice that the census tracts are very, very small. And so you may look at you may be looking at one tract and be like, that doesn't encompass the whole kind of neighborhood or whatever particular geography you're looking at. You can actually combine tracts together, and I'll show you how to do that. So I'll just go back to that South LA tract that I had selected. And I'm going to remove this one from down here. And what I'm going to do is I'm going to select multiple tracks. I'm going to select these 3 tracks. You can just do it by clicking, or we also have a lasso tool. So if you wanted to, you could do something like that. And to remove anyone, you just kind of click it again and it removes it. But I'm just going to combine these 3 tracks together. So I have those tracks selected, and now I'm just going to select combine selected tracks. And then what it does is it adds it to your current selection listing, but it refers to it as census tract group 1. That's just by default. You can't make any changes to that. But as you're doing it, you may put together like 3 or 4 different census tract groups. It would be census tract group 1, census tract group 2, etc. I'll create my table, and it's going to aggregate. It's going to have a custom polygon of the area that you selected, and then recalculate the estimates that you're looking at with regards to here. We have serious psychological distress and Hispanic or Latino. And you can do the same for any area, and they don't have to be tracks that touch one another. I know we previously did something for for a group that represented these rural health clinics, and they wanted to just create for the area, for the census tracts where their clinics are, and you could select a tract for clinic 1, clinic 2, clinic 3, clinic 4, combine those together and get an estimate for whatever indicator is in here. So it's pretty nice in that regards. Now, as far as combining for locations such as cities or counties, you can also do that. You want to do this here. Maybe I want to combine Los Angeles County and Orange County together. Now, one thing is that with regards to combining the geographies, they have to be the same type of geographic type. So I can't combine, say, Los Angeles County with the city of San Bernardino. That it won't allow you to do that. It has to be the exact same geographic type. So I can combine cities with one another. I combine tracts with one another. I can combine counties with one another. I could combine legislative districts with one another, but not a mix and match in that realm. So I'll just do Los Angeles and Orange County. Add to current selection, create my table, and now you see that I have the custom for that, and it's thrown into the data table. One last thing with regards to your legislative districts, some people know them right off the top of their head. I'm one of those people, or I don't. So we have this legislative district tool here. I'm just going to remove LA County, and what you can do is you can just enter in. I'm going to enter the address for that tract that I was looking up in South LA. Enter that in there, and it's going to tell you specifically, okay, this falls in Assembly District 59. It also gives you information on who the representative is for that. So that can be useful in many different ways. But I'll just add this Assembly District 59 there, create my table. And now you can kind of you can kind of almost put together your own customized health profile if you want. And in this instance, I just have, state of California, Los Angeles, and Orange County combined, my Assembly District 59, and my census tracts here. So there's a lot of different things that you can do with that realm. Exporting is very simple. You can export the table, which is just going to export your data table into a CSV file. You can export the map. Keep in mind, when you export the map, it's going to export it as a .png file. I find this to be really useful for if you're doing like a PowerPoint presentation. The one thing I'll let you know is that it's going to take a snapshot of the map at the level that you've zoomed in. So keep that in mind. Sometimes I usually, for when I'm doing something like the counties or the congressional districts where I can get the whole state of California with a different core path, I usually do that, and then I'll just download it. It does its thing. Yeah, I'll save it here. And then you'll see here, actually I can't share with you, but sorry, I just have this on my browser here. But it'll allow you to view this whole, do that, and it'll show the comparison table, the little bar graph, and then whatever level your map is. So if you're just focusing on, say, maybe Southern California, it's probably best to just zoom in to a level on Southern California so that you get a better view of it. You can save these to your library, give it a name, however you want to name it, and then save it. And then that way you can go back to it and build up on it, build off it, etc. So yeah, that's AskCHIS Neighborhood Edition in a nutshell. There's a lot to work with. I just kind of wanted to go through the whole process of how you select the geographies, especially with the census tracts. It's a little different from the counties and the cities. But there's a lot to work with. I always recommend people to just explore. But again, if there's as you use this platform, or if there's any questions that aren't answered in the help section, by all means, email us at chis@ucla.edu, and we can work out any issues that you may have. I'm gonna switch gears now, and I'm gonna talk about our UCLA Center for Health Policy CHIS preliminary monthly estimates dashboard. Real quick, can I get a thumbs up from someone that they can see that I've changed the browser over to the center's page? Tiffany?
Yep, we can see it. Thanks.
Fantastic. Okay. So we do in AskCHIS, we have data for 2021. We have COVID-19 estimates in there for 2021 that you can explore and cut up. But I know COVID-19 is 2021 seems like it was a long time ago in a galaxy far, far away. So we've created these preliminary monthly estimates dashboards for COVID-19. Since right now we're nearing the end of the 2022 data collection cycle, but we have our COVID-19 monthly estimates dashboard here. We had some newer questions added, such as in 2020 and 2021, it was more for vaccination, it was vaccine acceptance. We were asking them, if there was a vaccine available, would you take it? Whereas in 2022, the vaccine was already, people were already getting vaccinated. So we were actually asking about their vaccination status, getting information on whether or not they were fully vaccinated, partially vaccinated, or not vaccinated, as well as for those that were not fully vaccinated, getting information on the reasons why they weren't fully vaccinated. The vaccination status question also is something that we have for the June, May, April, and February, March estimates. We also have this information for teens and children. We're still, for July, we're not including that because there's just samples really small and there's a lot of instability and suppression. But this just kind of allows you to get a more as close to up-to-date information on the COVID-19 data as we can, because we do have that in AskCHIS platform, but it's from 2021, and considering how much stuff changes in these years, we felt that it's important to have these preliminary monthly estimates. So you have information on COVID-19 treatment, COVID-19 vaccination status, COVID-19 booster, risk reduction behaviors, personal impacts of the pandemic, COVID-19 news information sources, as well as we have a specific section for Asian, Native Hawaiian, Pacific Islander specific COVID-19 questions. This data is, I think this is all from, February through May, pulled together February through May for the NHPI adults. And a lot of it is hover over, get more information. You have these filter by different health indicators, sociodemographics, age, gender, California region, educational attainment, etc. So I just briefly wanted to go over that real quick to let you know other options with regards to getting COVID-19 data. That's all I have. I think we're ready for the Q&A. I will stop sharing the screen.
All right, are we ready for some Q&A? Let's do it. So we have a bunch of questions from the audience. As we mentioned before, if you do have questions, feel free to go ahead and use the Q&A function in Zoom and we'll get through them. So let's get started with a question on AskCHIS. Where it says a 95% CI means you can have 95% confidence that the percentage will lie between the upper and lower limit indicated. Does this translate to a 95% probability?
It simply relates to that producing that estimate is within the 95% confidence interval.
Thank you. We had a question on, hang on. Are the data available to do further secondary data analysis for academic publications? And if so, does it require IRB approval?
So I really encourage the person who asked that question to go into Get CHIS data, and it will take you to the public use files and the DAC. You're doing a research study, it's likely that you are already working with your IRB. And so that data would be included in your application to your institutional IRB.
Thanks, Peggy. General CHIS question. Does CHIS provide any data for housing insecurity and homelessness as it exacerbates a lot of health conditions?
Okay, so we don't collect homelessness data on homeless. We're looking at the housed populations for the CHIS. As far as housing insecurity, we have in 2021 we included, let's see here, I'm sorry, questions on if they worry about struggling with mortgage or rent, or feelings towards current housing situation. So those are some that are kind of close to it. But as far as looking at like the homeless population, no, we do not have that information.
Tiffany, there were a couple of questions on the new data. There was a question on climate change. Someone had opened up their account, could not find climate change. So
yeah,
did you answer that already?
I didn't. So yeah, someone had said that they created an account on AskCHIS and tried to look up data on climate change, but it doesn't come up in the menu of health topics or any other main options on the topic pull down menu. How do I get the climate change data that was just mentioned that were added in the latest version of CHIS in your presentation?
It is there. I'm not sure why that was not seen.
Here, let me share my screen.
Okay,
yeah, I was just going to ask if somebody
Thank
could
you,
do that. That'd be
Jacob.
great.
Yeah, no problem. Okay.
It's not in alphabetical order, so that
right.
is part of it.
Yeah. So down here, you can select climate change. The different indicators here. Climate change makes you nervous, depressed, experienced extreme weather-related event in the past 2 years, physical health, etc. So you just select one of those, go to get data. But if you're still finding issues, email us. It may be a browser issue. I'm not sure. It's hard to diagnose without seeing your screen. But that's usually for me. Usually, what I do is I'm one of those people. I go through the topics. I don't use the search. But that's because I know where they're all at. But
I know. But I have to say that I've been using the search a lot more because of the new topics. Yeah. And it really helps to see what category they're in. So I encourage the person who asked that question. There was another question regarding the age breakdown for psychological distress, I think. And so, Jacob, can you pull your screen back up? That you look in the demographics. And so whatever the topic is, having that age breakdown, you can look at under demographic, age and gender. And as you can see the age groups, and there are, I think there's 2 or 3 options there that give you several levels.
Yeah, if you want to go really minute, you can do this here. You also have the ability to limit your population. So if I was, I'm just going to go. So there's a lot of different options here. You could limit your population. So maybe you just want to look at general health status for those that are under 5. I could do that, and then it's gonna give me my estimate for those under 5. Obviously, when you're doing that, you're kind of cutting it down, especially if you're looking at say like a county, it's when you chip down on the sample, it's going to, you're going to get more suppression or instability, and that's where you probably want to consider pooling your data. But there's a lot of, with regards to manipulating and massaging it by age, there's a lot of different options. You could either compare topics. I would say if you're really looking at specific ones, compare topics by the age 19, or just limit the population.
So I see there's still a problem on climate change. So I'm putting up the email. I think you had it in the chat box. If there's any question we can't answer, you may be having a technical issue. You can send an email to the CHIS team at chis@ucla.edu.
Thank you, Peggy. Just a quick follow-up to the housing question, in addition to the question on if there's any question based on housing. Is there data available on where people live? So how many people are in the household and the type of household?
Yeah, so in AskCHIS, place of residence, we have information on rural, urban, housing. This is more kind of a feeling. I think we have, as far as the type of household, I think we have, I'm thinking that's
Number of people in the household?
We don't have number of people.
Okay.
We don't have number of people in a household. That's something that you'd have to look at through like a PUF, the public use file.
Okay.
Yeah, we have type of housing and own or rent. So you might want to explore that topic in, I'm sorry, under place of residence. Look at the different options on housing. So there's not a subtopic on number in the household, but type of residence. Maybe that might be helpful.
Thanks, Peggy.
Yeah, so years lived at current residence, owner rent a home, type of housing structure.
Are the race and ethnicity data available for specific ethnic groups such as Filipino, Vietnamese, Salvadoran, etc.?
Okay, so we do have, if you go into demographic, race, ethnicity, we have a besides just kind of like the race groups. We have Hispanic, Latino origin. This is just a binary, but we have Asian ethnicity groups here. So this will break it down by Chinese, Japanese, Korean, Filipino, South Asian. Keep in mind with these, because when you're looking at this is only looking at the population that identified as Asian. So it's going to be, there's going to be sample issue with that. So probably when you're exploring that, think about ways, think about pooling your data. We also have, these are good ones here, these any mentions of. So it's, we have any mention of Pacific Islander. So this could be someone that is, a multiracial, but they said, yeah, I'm Asian Pacific Islander, I'm Hispanic, Latino, and I'm white. They would be, this is a way to kind of like boost your sample size, especially for groups like NHPI. So I would say when you're using AskCHIS Neighborhood Edition, look at the compare by race, but then also consider including the any mention of, because this is going to include those folks that are multiracial, and we're seeing a trend, especially here in California, that more people are saying they're multiracial. They're not just one specific race. They're they're two or more. So the any mentions of, you just kind of scroll down and you'll get down here to see that. And then we also have Hispanic, Latino ethnic groups. So Mexican, Central American, Puerto Rican, South American. Part of it is just kind of sample size. We just decided like we're not going to go specifics beyond Central American. I know someone asked about Salvadoran. We just kind of combined we collapsed all those Central American countries together.
And then as a follow-up to that, somebody asked if we have foreign-born data by country of birth.
While you have your screen up.
Say again?
Yeah, it's in the demographic. Residency in the United States includes subtopics around citizenship and immigration status, country of birth.
Yep. Please note that for citizenship and immigration status, we just have U.S. born citizen, naturalized citizen, or non-citizen. Just because it's a very sensitive topic, we didn't break that non-citizen down from undocumented non-citizen to documented. So just want to let you know that that's something, if you're really interested in looking at information for those immigrants that are undocumented, you're not going to find that information in AskCHIS. That would be a special DAC request.
Thank you. And then another follow-up to the race and ethnicity question. Does the data include Middle Eastern and North African as a group or race?
So we do, for 2021, we did construct a MENA, Middle East, North African variable. We didn't include an AskCHIS just because the sample is so small. We want to wait until we have multiple years so that you can pool, because it's an instability. But I believe it is available in the PUF if you wanted to explore that. But it's not essentially, and just a follow on with that Middle Eastern North African variable, that is based off of when we ask questions about white origins, if we ask them specifically, what origins are you from for your white ethnicity, your white racial category, that's kind of collected through that. It's not specific. We don't have any specific question that says, are you Middle Eastern or North African? And I know some of this race stuff, it's tricky. Right now we're going based off of the census guidelines, and I think that the census might start making some changes. So I think when they do, we'll be making changes as well.
Thanks. A question for you, Jacob, on AskCHIS NE.
Sure.
How should someone go about obtaining data at the census tract level for variables not included in NE? And would data at this or other sub-county level be available in the confidential data files?
Okay, so for CHIS, you could do a DAC request. I think the thing is that these are modeled estimates. So we do have a whole, you could submit a request for some custom small area estimates. There is a price tag behind that because of just the labor hours in developing those. I think other things to consider are just there's other sources of census tract data out there for health data. I would explore other areas, but I think also look at putting in a DAC request if you want to find out more about how much it would cost. It's a little bit of a process because to develop these small area estimates, we need to have good sample, and it's going to require multiple years of data, not just like if it's just a 2021 indicator, like if it was just so for example, gun ownership in 2021, that's not enough data. We're going to need to have a couple of years of that to be able to model it. So there's a lot of factors revolving around how we develop these SAEs.
Thank you. And I'm just going to put a link to the DAC email address in the chat for those who need it if you want to make a request. And DAC is the Data Access Center. I think we've mentioned that before, but we're so used to the acronyms here.
I know.
So another question on E, are there data visualization features similar to Tableau available on CHIS, or is it possible to feed raw data directly into such software?
I mean, yeah, I mean, I guess it depends on what you mean by raw data. I mean, you could do a public use file download and work with that. I think the one thing with the public use file is that it's just for California overall. There's no variables that break down different geographies like county or zip code or anything like that. But you know, from AskCHIS, you can export into a Excel file the tables, and if you have the time and the know-how, you can massage those to format those to be to upload into Tableau. So there's workarounds.
Thanks. And I just dropped the link to how to access the public use files in the chat for people who want more information on that. Do we need to worry about statistically unstable data in the GIS maps? Will we be warned about that, or does the data modeling ensure stability?
So for for AskCHIS Neighborhood Edition, let me just show it to you. I'm going to go to this one here. Loading up. As you see your choropleth map, and it's more so in the smaller areas. So like when you're looking at zip codes and you're looking at census tracts, you notice like right below this geography, we have this one here. So it says it shows you estimated population, but it says estimate is unstable. Please combine geographies for a pooled estimate. So anything that's unstable in AskCHIS Neighborhood Edition is suppressed. It's not going to come up. It's just going to come up as unstable. So if I added this tract to my data table here, it would get kind of like your asterisk, and you hover over it, it's an unstable estimate. So with regards to suppression, it's either we're suppressing data based off of the population of the geography, or based off of whether or not the estimate itself is stable. We define stability in both Neighborhood Edition and AskCHIS as having a coefficient of variation that is greater than or equal to 30%, 0.30. That's how we're defining an unstable estimate. So in AskCHIS, the normal AskCHIS platform, when an estimate is unstable, it will still get shown. It'll just have an asterisk saying like, hey, this is an unstable estimate. In AskCHIS Neighborhood Edition, an unstable estimate, as you see here, is it's suppressed. Ways to go or work around that is maybe consider combining this. So maybe create both these tracts as a custom tract, and then maybe that'll give you an estimate, and you could use that as a proxy for that specific tract.
And then on any as well, are you able to map 2 layers, or is system only mapping 1 layer at a time?
This is only 1 layer at a time.
Thanks. I believed you walked through this, but just a quick yes or no. Does AskCHIS any have data by race ethnicity for indicators at the city level? For example, smoking prevalence?
So we only have smoking prevalence for the overall population. We don't have it broken down by race ethnicity. It's an issue with sample as well as computational time required to do that. I think we're having talks on looking at ways around solutions to doing that, because I know that's something that's a lot of people want to see more than just kind of like the overall population. You can get smoking. We have tobacco use. 2020, we have current smoker, e-cigarette user, flavored tobacco, secondhand smoke exposure. But again, that's only for the entire population. For these ones, it's 18 and older. I would say right now, kind of like it's not the greatest solution. It's not the greatest workaround, but it's something that might be useful, especially if you're looking at tracts or city, anything smaller than a county. What I would recommend doing is plug in current smoker, and then also maybe throw in race ethnicity to get an idea of if you're focusing on the Black population or Hispanic or Latino or whatnot. You might be able to get a sense of like, wow, there's a high prevalence of smoking here, as well as there are a majority of this specific geography. I think that's kind of the closest thing. And obviously you want to have, it's better to have, this is the breakdown by race and ethnicity, but right now we do not have that.
Thank you. How do we cite data from CHIS in a research paper? Does CHIS have a preferred data set citation format?
I will turn that over to you, Tiffany. That's a unique question. Tiffany handles all of our publications. I'm not sure it's explicit on the website.
Yeah, I don't think it really is, and it depends on what kind of publication you're working on. I think if you do have specific questions about your research paper and you do want to reach out, you can email us at healthpolicy@ucla.edu, and we'll get that answered for you. Would you be willing to provide a training as part of a larger webinar? If so, is there a fee to provide the training?
Well, there is a fee for customized training, but please send an email to if you are interested to, again, chis@ucla.edu, and they can respond to your interest and provide you with information. Tiffany, there's another question here about skilled nursing facilities and assisted living communities. We don't survey those that are in, I forgot the category, but where they are the housed populations in like nursing facilities or assisted living communities. Because these are all randomly selected through the CHIS process, and those types of facilities, we do not survey the population.
Thanks. And we have a question that came in too about whether or not CHIS has limited English proficiency and non-LEP data by race and by county.
I'm sorry, what's the question again?
It's in the chat. Does CHIS have LEP and non-LEP data by race and by county?
Let's see. Are you looking at it, Jacob?
Yeah.
Under demographic, let's see.
So we have how well does respondent speak English? The wording of the question is, so this so keep in mind the universe is respondents 18 years and older who speak any language at home that is different from English. So this wouldn't be for the entire population. It's only for those folks that speak a language other than English at home. And so we say, since you speak a language other than English at home, we're interested in your opinion on how well you speak English. Would you say you speak English very well? So we have very well, not well, / not at all.
Thanks. Are you able to see sample size for each of the metrics? This is for AskCHIS specifically.
Okay, so what you're getting is the weighted population. You're not getting the actual survey sample size. If you wanted to get that, I would recommend doing getting a public use file, and you can run that through your, any statistical package like R, SAS, or state, or SPSS.
Thanks. Any plans to include sexual health survey results under health topics?
I think that depends, if we're talking about any sexual health questions in the CHIS, that depends on sample size and how many years of data we have captured from that. If we're talking about outside data sources, I'm not familiar with any kind of any surveys that have geographical data on sexual health. So it's something that we'd have to explore further.
Thank you. Is there any data about green spaces and parks?
Yeah, it's kind of limited. We have housing in neighborhoods, so we have information on nearby park or playground safe during the day for children. It's not super robust. We have information on whether or not they're in a rural or an urban area. So it's just I would say for those kind of niche areas, I would definitely recommend exploring the categories or going through the search and typing in the search and seeing what comes up.
Thank you.
Tiffany, going back to the sexual health question, there are some questions that are relative to sexual health. So if you look at health behaviors, sexual activity is included, and that may be helpful to add to any other data you may have about sexual health.
Thank you, Peggy. I know that we've only got 5 minutes left, and there are a couple of other slides that we want to get through, but we do have a question on what the selection process for CHIS survey respondents is.
So they're selected from the, and I need you to help with this, Jacob. I know that it's a web-based online.
It's a web-based survey. We send out mailers to kind of do. I'm not well versed in that area. I know we send out mailers, and it's not just a massive mail. It's kind of like it's done kind of like in a very specific methodological effort. It's like mailers sent out saying, hey, you've been selected to do the CHIS. You can do it via the web, or you can take in a phone call. I would recommend going through our methodology reports that we have on the Center for Health Policy Research webpage, because it definitely breaks it down and kind of gives you an idea. It's a very complex process, I guess what I'm trying to say.
Yeah, it's California. Look in the CHIS section under design and methods, and there's a number of reports and briefs and technical papers that describes their methodology.
Thanks. And then just one quick follow-up on the climate change. So the individual was looking at AskCHIS versus AskCHIS, but they did want to follow up and ask if that climate change data will be available on AskCHIS in the future.
Possibly. I think it's we have to consider it. We have to look at when we get the data for 2022 if we have enough sample. I know there's a lot of newer data there, and we're kind of thinking, do we need to add COVID? But it's up for consideration. I know that.
Thanks.
Tiffany, I know there's only a few minutes left, and I just want to remind her to please complete the survey. We want to hear from you, also what you're interested in. So if you complete our evaluation survey, the link is in the chat box before you leave today's webinar.
And I think, Peg, we can turn it over back to you if you want to close us out.
Sure. Again, thank you. Let me share my screen. I just want to point out to please contact us and utilize those resources. It was in the box. Go to the CHIS website. There are a lot of resources. We showed that today. The AskCHIS On-Demand Learning Center for tutorials and videos, and then the all-important CHIS at ucla.edu. If you have any further questions or technical assistance, excuse me. And the other thing, I just want to thank Ninez Ponce, our principal investigator and the UCLA CHPR director of our center, Todd Hughes, the CHIS director, and the California Endowment, who makes these webinars possible. And finally, again, please complete our survey. It's really helpful as we plan out future training webinars and for our CHIS team to better serve our data users. And with that, we can close out the webinar unless there's any other items before we close.
I think that's it. Thank you so much, everyone, for attending.